Okay, hello, good morning, and welcome to my presentation on the nutritional, environmental, and socio-cultural considerations for moving to sustainable diets in South Africa. Diet plays a crucial role in the health and well-being of individuals and populations. A healthy and sustainable diet is one that meets the nutritional needs of individuals and populations while promoting environmental sustainability and social equity. In this presentation, I will be summarizing the evidence for the nutritional, environmental, and socio-cultural elements of a typical South African diet. I'll be identifying changes needed to make the diet more sustainable. I'll be identifying the drivers and challenges to moving towards a more sustainable diet while discussing the relevant synergies and trade-offs. The typical South African diet is characterized by consumption of refined carbohydrates, unhealthy fats, and low intakes of fruits and vegetables and whole grains. This diet is high in energy but low in nutrient density, resulting in a high prevalence of obesity, diabetes, and other diet-related diseases in the population. A study conducted by the South African National Health and Nutrition Examination Survey in 2012 found that only 25% of adults consumed the recommended 5 servings of fruits and vegetables per day, and 27% consumed more than 30% of their total energy intake from unhealthy fats. Another study conducted by the Global Burden of Disease Project estimated that dietary risks accounted for over 13% of the total burden of disease in South Africa in 2017, with high consumption of processed meat, sugar-sweetened beverages, and low intakes of fruits and vegetables being the major contributor to this burden. Furthermore, the consumption of ultra-processed food in South Africa has more than doubled since 1994. The typical South African diet has a significant environmental impact due to the production, processing, and transportation of food. The livestock sector is the largest contributor to the greenhouse gas emissions in South Africa, accounting for 58% of the total agricultural emissions. The production of maize, which is a staple food in South Africa, also has a high environmental impact due to the use of fertilizers and pesticides, as well as the high water consumption required for irrigation. The South African diet is heavily influenced by socio-cultural factors such as tradition, religion, and income. The traditional South African diet, which is rich in whole grains, vegetables, lean protein, has been replaced by a diet high in refined carbohydrates, unhealthy fats, and processed foods due to the influence of globalization and urbanization. Additionally, the high prevalence of poverty and food insecurity in South Africa also contributes to consumption of low-cost, nutrient-poor foods that are readily available and high in energy and low in nutritional value. Furthermore, cultural practices such as the preference for meat, particularly beef, as a sign of social status and masculinity, also contribute to the high consumption of animal products in the South African diet. South Africa, like many other countries, has committed to achieving the United Nations Sustainable Development Goals by 2030. One of the key focus areas for the country is promoting sustainable diets, which is reflected by Goal 2, Zero Hunger. This goal aims to end hunger, achieve food security, and promote sustainable agriculture. In line with this, South Africa has developed a national food and nutrition security plan, which includes measures to increase the production and consumption of healthy, sustainable foods, as well as promoting food waste reduction and sustainable farming practices. The country is also working towards reducing its carbon footprint by encouraging the consumption of plant-based foods and reducing the consumption of meat and dairy products. Overall, this is a very promising step towards achieving a more sustainable and equitable food system in South Africa. When moving to a more sustainable diet, it's essential to consider various factors to ensure that the transition is affordable, nutritionally adequate, accessible, healthy, and appealing to the consumers. The dietary changes should also protect biodiversity, industry profits should be considered, and livelihoods should also be considered. Affordability is crucial as sustainable foods can often be more expensive. The new diet should provide adequate nutrition and meet the body's needs. Access to sustainable food sources should also be considered to ensure everyone has access to healthy food options. And finally, the transition should also be appealing to consumers to increase the adoption of sustainable food choices. To make the South African diet more sustainable, several changes are required in the nutritional, environmental, and socio-cultural elements of the diet. These changes include to increase the consumption of fruits and vegetables, to decrease the consumption of ultra-processed foods, to increase consumption of plant-based protein, to increase access to healthy foods, and reduce food waste. Some ideas here would be to introduce taxes on sugar-sweetened beverages and ultra-processed foods that we know are detrimental for human and plant-free health. Also, subsidies and incentives for the production and growing of more healthy plant-based foods would be beneficial here, as well as education and awareness campaigns, food banks, and subsidies for meals and foods in lower socio-economic areas. Several drivers and challenges exist that can either facilitate or hinder the transition to a more sustainable diet in South Africa. Some of these drivers and challenges include government policy. The South African government has a key role to play in promoting a more sustainable diet by implementing policies and programs that support healthy and sustainable food systems. However, political will, resources, and stakeholder engagement are required to develop and implement effective policies. Number two, socio-economic factors such as income, education, and cultural practices can either facilitate or hinder the adoption of a more sustainable diet in South Africa. Low-income individuals may have limited access to healthy and sustainable food options, while cultural practices that prioritize meat consumption can make it difficult to shift towards a more plant-based diet. Number three, infrastructure. The availability and affordability of healthy and sustainable food options depends on the infrastructure in place, such as transportation, storage, and distribution systems. Number four, industry engagement. The food industry has a significant influence on the food choices and preferences of consumers. And industry engagement is needed to promote a more sustainable food system. However, the industry may resist changes that reduce their profits, making it challenging to implement effective policies. The changes needed to make the South African diet more sustainable are interconnected, and there are both synergies and trade-offs that need to be considered. One of the many examples of this is increasing the consumption of fruits and vegetables and decreasing the consumption of ultra-processed foods can have synergistic effects on health, as both changes contribute to a more nutrient-dense, healthy diet. However, increasing the consumption of plant-based protein sources may have trade-offs for cultural practices and taste preferences, particularly among populations who enjoy eating. In conclusion, achieving sustainable diets in South Africa will require a multi-sectoral approach that involves government, civil society, industry, and consumers. Some potential ways to achieve sustainable diets include: number one, development and implementation of food policies. The South African government can develop and implement policies that promote healthy and sustainable food systems, such as taxes on sugar-sweetened beverages and other processed foods, subsidies for healthy food retailers in underserved areas, and incentives for plant-based agriculture. Number two, education and awareness campaigns. Public education campaigns can help raise awareness of the benefits of healthy and sustainable diets and promote behavior change among consumers. These campaigns can be targeted at different groups such as low-income populations, school children, and healthcare providers. Number three, industry engagement. The food industry has a significant role to play in promoting health and sustainable food systems, and industry engagement is needed to develop and implement effective policies. Industry-led initiatives such as the introduction of plant-based protein products and the reduction of food waste can help promote a more sustainable food system. Number four, infrastructure improvements. Improving infrastructure for healthy and sustainable food systems, such as transport and storage systems, can increase the availability and affordability of healthy food, particularly in underserved areas. And finally, addressing socio-economic disparities, such as income and education, can help ensure that all South Africans have access to healthy and sustainable food options. This can include the establishment of food banks, subsidies for healthy food retailers in underserved areas, and public education campaigns to target low-income populations. Thank you for listening, and please see included a list of the references used for today's presentation. Thank you.